Good evening, ladies. We'll just give it 2 minutes and then we'll start. Hope you had a good Sunday. Good evening, ladies. Thanks for joining on time. I'll just give it 1 minute just for anyone that's having technical issues. Okay, we'll go ahead and start. So welcome. I hope you've had a great Sunday and you're feeling relaxed. Hope you've got some herbal teas and a pen and paper to take some notes. If you can try and keep yourself muted, that would be great. If you've got any questions, if you could put them in the chat and I will see if there's time at the end to try and answer them. So for those of you that don't know, I know there's a couple of names on here that I've not been acquainted with, but I'll just give you a brief overview of who I am. So my name's Nina Lemtier, and I'm a nutrition lifestyle strategist. I found myself in this very rewarding space by accident because I basically struggled with fibroids for the best part of my 20s and early 30s, and I had no idea that I had them. They caused immense disruption in my life. And I was really stressed because I was a business owner, a traditional business, and it was really stressful. And I had no time to even go to the doctors if I was not feeling well. So I was basically working all the time. And to cut a long story short, I had no idea what fibroids were, but I had fibroids that were really big. One was nearly as big as a football and had caused my miscarriages. So when I was at the point of having them looked at, I was basically told that I would highly likely lose my uterus whilst they were performing the myomectomy. So I needed to just be prepared for that. And I just said, that's not an option. So we have to do something, things have to be done differently. So what was then proposed, and I said, just focus on the large fibroids and leave the rest of them so that we can cut the operating time, therefore reducing the bleeding, potential bleeding. And luckily I did that because it was very touch and go. I bled a lot, and I was told that the high chance they'd grow back, and I needed to just try and see if I could have one child as soon as possible. So I needed to find out why mine had grown so big. I couldn't continue with my life as it was. I knew a lot had to change, and over the years, I've helped myself to a degree that the ones that have left behind have been getting smaller over the years. They're now insignificant compared to what they were. I've had my 3 children. My youngest is 1, and I've never felt better. I've just turned 40, and I feel so much better than I was in my 20s, in all honesty. So I am very passionate about empowering women and just really giving the understandings of what you can do, obviously alongside medical advice, because I'm not removing the role that the medical field play in our lives. It's a very critical role and a very appreciative one. It's just there is so much that we can do to help ourselves through diet, nutrition, and lifestyle that will make a huge difference to your results. So what we're going to be getting into today is to just give more details in regards to the myomectomy procedure, and how it has evolved over the years. Because when I had it done, there was no guidance on actually shrinking the fibroids before doing the procedure. So it was just a case of getting them out, and you go on with your life. Whereas now it has evolved a bit. So we're going to go into a bit more of the details of that, and obviously the impact that has on fertility. And unfortunately, women really don't realize the magnitude of this procedure, and they're having them done in like multiple procedures of this. Like I've spoken to a woman that's had 3 of them done, and unfortunately, it's cost her her fertility. Unfortunately, so women really do need to be aware of what this is really about. Okay, here we go. So just to give you information about what I do very briefly, because I know that there'll be women on here that want to know what they can do with me in regards to how the information that they get, maybe in relation to their personal circumstance. So you can take a screenshot of this, and these are the options that I've created in the last year due to the success of my workshop and just listening to feedback in regards to really accessibility and things. So yeah, these are solutions that as we progress through this presentation, you might be thinking, what can I do? And these are some options. So what is a myomectomy? It's a surgical removal of uterine fibroids while still preserving the uterus. And it's commonly offered to women who experience really severe heavy bleeding, very painful periods, sporadic pain, even off periods and menstrual cycles, and ultimately they're experiencing a level of infertility. So they've been trying to conceive and they have fibroids and they're not conceiving. Now, what have I just done? Apologies. Okay, there we go. So what is interesting is that the procedure innately is to retain fertility. And that's where the big question mark really does come in, because right now women are being kind of offered this as a standard, whereas actually you're meant to be qualified for this. So we're going to go into what that qualification looks like now. Now, the risks associated with a myomectomy are quite extensive, and I wasn't actually aware of the extent to the risks. So a hemorrhage can potentially happen, which is either during the procedure, which I may have actually experienced as well, because I bled a lot, and it was, as I said, very touch and go in my case, because arteries were touched and things happened. And when this happens, it's very risky. And to save your life, they will just take out your uterus. And it could also happen after the surgery. And this is dangerous as well, because if you don't pick up in time. Sorry, could someone, I think there's somebody not echoing. Whoever just joined, could you mute yourself? Thank you. And you're basically you need to pick up on the bleeding in time, because it can get very complex. And obviously they're going to have to open you up to find the source and address everything. So that's a risk. Infection is a risk as well. So follow the guidelines in regards to what you need to do before the op. Adhere to those guidelines as much as possible to keep your risk low. And of course, afterwards, follow the guidelines given to keep this risk low. And adhesions. This is a very common recurrence in regards to what happens and the risks associated. And it happens particularly for fibroids that are intramural, so within the lining of the uterus. Those tend to cause significant adhesions compared to the ones that are within the cavity or outside the uterus. And because of this, particularly the ones that are within the lining, it impacts fertility more so. And then there's a possibility of a uterine rupture. This is rare, but it happens particularly when women get pregnant quite soon after the procedure. So that's why it's important to allow the body to heal and follow what your doctor gives you in regards to guidelines and following that, because you don't want to compromise your uterus. And the need for surgery, this is a very huge risk. And unfortunately, it's one that is happening more and more, because fibroids they grow back. And if you don't address your contributing factors, root causing factors of why your fibroids are growing, especially once you've had a removal, then your risks of them growing back are high. So you're in the right place to really get the understandings if that is you've had a procedure in the past. So adhesion formation after myomectomy, it actually occurs between 25% and 92% of cases. So it's very high occurrence. I have obviously scar tissue, and I've been having more scar tissue over the years because I've had C-sections for all 3 of my children, and each time. Now, because of how I lead my life and my understandings of nutrition and the way I do, I have been living for the past kind of nearly 10 years. It's meant that I've had no complications. So it's not about really being fearful. It's just being having the understandings and taking action of what you can do to just be more proactive, because this is not about creating fear, it's about equipping you with information. So if I hadn't made the changes that I made, when I had the procedure nearly 10 years ago, then the way I live now would be a lot different. I probably wouldn't have my 3 kids, and I wouldn't be in the health that I am now. So it's not about fear, it's just about equipping yourself and just being proactive rather than reactive. So adhesion formation also is higher, as mentioned, when the surgery is posterior wall surgery, with basically fibroids that are within the lining, intramural fibroids within the lining of the uterus. So this means the risk is a lot higher. Larger size fibroids, this is why it's really important to try and get them smaller, whether that's naturally through diet, nutrition and lifestyle, or you might be guided with a level of intervention, which I'll go into. When incisions are longer, this causes more complications with the adhesion formation and the surgical techniques of the actual surgeon. So this matters as well. So having a conversation around this is really important, just to see, if there is a particular technique they're going to follow, what is that technique? Have that conversation with your consultant. Now, the impact of adhesions on fertility is really important. What is happening quite often, I've spoken with quite a few women that have experienced this, is their fallopian tubes get blocked. And this prevents the egg from traveling from the ovary to the uterus. It can be partially blocked, it can be completely blocked. I've not spoken with a woman where it's been both of them, it's usually just one. But this is something that happens because of the way the tissue heals and obviously the adhesion formation. So also ovarian function is restricted. This is basically the ovaries movement is restricted, and it impacts the ovulation experience that happens. So this is another impact of the adhesion formation. And then the implantation disruption. So due to the surface area changing and reforming in a unnatural manner, it impacts the ability that the fertilized egg has to attach itself and obviously grow and continue the formation. So these are the 3 main implications of adhesions on fertility specifically. So this is where you need to, if you've not had a procedure, these are the questions you want to be asking before. Have a conversation around that. We're going to go into what you can ask about as well in this training, and also afterwards you want to be having. Sorry, can you mute yourself, whoever just came on, please? You want to be having conversations about these 3 areas specifically.
It's a bit random. Collectibles, look at the bubble, and pockets of themselves. Do you think showtime? Maybe they're not exactly like you. Angus is back.
I'm going to try and mute.
Same mistake, please. What is that? And catch him.
Sorry, just had to find those people and mute them. Okay, so the techniques to minimize adhesion risk. Now, laparoscopic and robotic assisted techniques are reduced now to reduce the adhesion formation. So this is great in the sense that you may not have to have the open myomectomy. It can be done in a less invasive way. Meticulous surgical techniques, so how the surgeon goes in a very meticulous fashion, in a specific way, and actually makes really proactive steps to be careful in regards to how they're removing the fibroids and obviously performing the procedure. And this will also impact blood loss as well. having a conversation with your consultant as to the barrier agents that they will potentially use. So there is a separafilm barrier agent or an interseed film that can be used to prevent the tissue adherence as well. So finding out which barrier agent they're going to use, and if they're not, asking them to use one, because this is a key part of reducing the adhesion formation. Okay. And shrinking the fibroids as well, operative, is really key, whether you do it naturally or through GnRH, which is a hormonal injection. And this works, and it doesn't work as well. I've spoken to quite a few women that unfortunately it didn't work, or it worked, and then as soon as they stopped the treatment, the fibroids grew back very aggressively. But this is also an approach that may be offered depending on the size and the location of your fibroids. So a second look laparoscopy, SLL, is performed post-myomectomy, and this is to basically check and remove any adhesion formation that is clearly going to be cause complications. So they basically go back in and look and check and then remove anything that they can see that is just needs to come out. This can help women that are concerned with fertility and are having severe levels of scar tissue and adhesions formation. So it's an option that can be performed in this case. So ovary pexi is a process to basically protect the ovaries during the procedure. They temporarily reposition the ovaries, and this protects them during and avoids them getting entrapped within the procedure, and obviously as healing takes place afterwards. And it also supports procedures like IVF and egg retrieval. So this is something that you again need to have a conversation about. And if fertility is your focus, then this is something that needs to be explored to really protect and preserve your ovaries whilst doing the procedure. Now, why would a woman be qualified, and what are the factors that warrant the qualification? It's the fibroid size, okay? Depending on the size of the fibroids will depend on whether this is going to be an option. Now, what's happening more and more is you would be encouraged to try naturally for as long as possible, because you can see the complications that come with this procedure are very, very high. So if your fibroids aren't so big, then looking at diet, lifestyle, and nutrition, and looking at other ways to really get them reduced is a more favorable option than just resorting to this procedure. Where they're located, as I've mentioned earlier, if they are within the lining, intramural fibroids within the lining, then this is more complex. This is going to cause more adhesions because of the way where they're positioned and what needs to happen to obviously get them out, compared with when they're within the cavity or outside. So this is an area that needs to be really factored in. The number of them, your age, and this is key, obviously, in regards to fertility and your ability to recover and heal as well. Your health, your overall health, if you are above your BMI, for example, in regards to weight, and then any other underlying issues that might complicate things in regards to the medication. So this is something that would be considered, and other fertility factors as well. So an alternative to the myomectomy, as I mentioned, a lifestyle adjustment is an alternative. IVF is or other options in regards to suitable specific cases. I know with IVF, it does depend on where they are, positioned, but at least, that is an option to explore if you're not conceiving naturally yet. So it's important to really be aware of what is really contributing to the growth of these horrid things, and really understanding that they are they're not, we're seeing an effect, so to speak. We're seeing the aftermath of other situations that have been occurring and are occurring within the body. And it's important to just be aware of what these are. So stages of the uterus acidity and body as well. It's not just restricted to the uterus, but obviously the uterus is the focus of where we're concerned with today. Now, it's important in regards to, this is something that gets very progressive over time, and it's the state of the tissue. Okay, it's the state of the cells, and the latent acidosis stage is early signs basically building up in your body, and your body uses buffer systems to really work hard in overcompensating and bringing about a pH balance. So for example, if you're mineral and vitamin deficient chronically, your body is basically working really hard to try and keep a level of balance. And what's happening is that it's using minerals to neutralize acids, and your body is overly trying in this because you're not giving your body enough. You are deficient. Okay. Now, the signs you'll see from this is that you're feeling quite fatigued. Even if you have a good night rest, you still find throughout the day you're feeling quite fatigued. You struggle to concentrate. You're having mood swings, and you're having kind of minor digestive issues. So these are signs that there is an imbalance, and this is the stage your body's at, the latent acidosis stage. And then it progresses on to the compensated acidosis stage. And this is where your body starts to pull minerals from tissues to maintain the pH balance, which is not good, right? Your body's now taking from where it shouldn't to try to maintain the pH balance. And it's buffering the capacity. The capacity is degreasing, and signs of mineral depletions become much more apparent. The fatigue becomes much more apparent. You're finding that you're getting irritable because maybe your sleep is being impacted. You might start having skin issues. Your hair might start falling out. I often hear that a lot, hair falling out. And your digestive issues are worsening. You might be feeling a bit constipated at times, bloated. You're finding that you're just not comfortable. This is the second kind of stage of it. And then you've got the acid accumulation. And this is where acid is now building up in connective tissues. Symptoms are much more noticeable now. You're probably getting sick. Your immune system is now being compromised, as the body is struggling to detoxify. And the tissues are now being compromised. The cells are being compromised. You're getting achy joints, muscle pain. Your digestive issues are worsening, and you're now having hormonal imbalances. And then it progresses on to acidic saturation. Now, acids are now deeply impacting organs and tissues. Okay, it's getting more serious now because you're having indicators like fibroid growth. You're having maybe joint issues, arthritis, reproductive issues. You're noticing significant changes with your hair, skin. So this is it, because I was like, what was going on? Like, how the hell did a fibroid grow to nearly as big as a football? Like, what was I doing? And then I thought about how I was living and how I was eating and the fact that it was, yeah, it wasn't good. And I could see how this had built up over the years and why it got really bad. Number 6 is this cellular acidosis and degeneration, which is, you know, the maximum breakdown. Basically, the cells are degenerating and it really gets very problematic in regards to how your body's functioning. Medicine is not having the normal kind of impact because absorption is really poor within your body. Your body's bioavailability is really poor. This is probably when, well, maybe before this, where you're probably taking supplements. You might even be on medication. I often speak to women that say they've been taking medication, but it's not working. It's not making a difference. And this is because of the stage at which they're at in regards to this acidity and where the cells are now. So when you're looking at any regeneration project within your body, you know, when you're looking at, okay, what can I do now to move forward? You really have to realize that there's a lot that is happening on a cellular level that needs to happen in that regeneration process. So you do have to be patient with your body and obviously loving of the fact that you're going in another direction. And you know, yes, you were aware and you weren't aware, but you know, at the end of the day, all you can do is take action on what you know. And as soon as you can start taking action, start to make those changes. Essentially what I'm saying is it's not going to be overnight. However, once you start going in the right direction, you will start to see positive signs. You know, as your cells improve, as the acidity improves, as the pressure is taken off, you know, your body to keep trying to create this balance. You're supporting your body in creating balance now on a daily basis. And this is important in regards to how you approach this mentally as well, because stress hormones also cause a lot of disruption in this balance that we've talked about, because it's not normal to have a certain level of stress hormones. And when you're not relaxed and when you're not, you know, managing stress and managing life essentially, because, hey, let's face it, stuff happens in life, right? But you have to figure out a way that you kind of wind down, switch off, and really get into a solid routine. It shouldn't be one off once a month, Valentine's, or, you know, a particular special time of the year. It should be literally every other day approach. What am I doing to relax? Is it reading a book? Is it a hot bath? Is it going for a walk? Whatever. It doesn't need to be something extravagant, but the aim is to just get you into a relaxed state. Meditation has been a game changer for me. Whatever works for you, but just getting your body in a relaxed state and doing that consistently makes a big difference on this environment that obviously is a very delicate environment in your body and affects us on a cellular level. As you can see, you know, fibroids again is it's a byproduct of a situation, a scenario that has been incubating over years. So, what steps can you take? What can you do? What can you focus on to get results? Because you can do stuff and you just feel like you're going round and round in circles. Nothing's working. You're not seeing the traction that you want to see. You're not seeing the changes that you want to see. So, what do you have to do? The first is you have to look at yourself in a personalized way and address your what your body needs from on a cellular level, you know. And yes, obviously look online, look at what other people are doing, hear what works for other people, but essentially what works for them might not work for you. So always go with a personalized approach and address what your body needs on a personal cellular level. That way you can adjust your diet very strategically, and then of course supplement with high quality pharmaceutical grade, always pharmaceutical grade supplements, the areas that need the support, because that's what it should always be. Supplement, you know, supplements shouldn't replace, it should be supporting gray areas, areas that need support in regards to your diet and your lifestyle. Could you mute yourself, whoever just joined, please? Who's that? Okay, thanks for muting. And the next step would be to address, as I mentioned, your lifestyle, what you can do in regards to stress management. It's a very key area. It can do a lot of damage in regards to your eating plans or whatever you might be doing if you haven't got it in place. So don't overlook it. It's easy to overlook it, so don't. And then look at a level of detoxification to support your liver and your gut. This is key in that overall balance, supporting your body to be more in balance and to take the pressure and not have your tissues and organs being compromised due to poor gut and poor liver function. Your gut actually is about 70% or over 70% of your immunity resides in your gut. So it's a very key area in the balance. So that would be an area to focus on. And really looking at it from a holistic approach. So yeah, that would be for me the main areas that would be significant to really improve, your uterus environment and your whole body balance as well. And when you do it from a personalized level, you will really you will change your results. One of my clients, Priscilla, she'd been at it for a good 4 years before we connected. And within 4 months, her fibroids reduced. Her biggest reduction was 5 centimeters. She could feel the difference as she was progressing through the program. And that's the difference between doing it generally with your body and then getting very concise and specific. So it makes a huge difference. So what would I do with you in regards to the transformation and really getting your body through those specific phases? Well, the first is to test and get clarity on actually what's going on, where the imbalances are, what are the markers telling us, you're taking supplements, great, you're doing this, great, but what's actually going on? And then leveraging from that point. This will improve as you transition through diet, because you'll be able to supplement the poor, struggling areas, and you will see the effects of this because things are easier to do in regards to changes in your food and your lifestyle. And when you're making these adjustments, it will be an easier transition, and this will be in line with your results as well. The food structure, your meals, supplements, everything will be in line with what your cells need. And then this will assist the repair and the cellular regeneration, as mentioned, because you're going to be in a certain phase, a certain stage. So as you're going through now, it will be key to assist that repair and help your body now regenerate from a cellular level. And then we will eliminate and balance through a level of structured detoxification. And it's very set, it's very proven. It works time and time again. And it gets you going in a very, very refreshing direction, and not just feeling wise, but actually your cells are being reinforced, and it's from a cellular level redirection. So these are the options. As I did put it on earlier, I've just put it on again. If you are wanting to do things differently, do things the right way from your personal, where you're at, what your cells need. It's a shorter. It's not my workshop. However, it's something that you know, as I said, I've just listened to a bit of feedback, and I've been working with a few women on this as well, and I'm seeing really, really great results in regards to their changes and what they're seeing in a relatively short space of time. So take a screenshot of that, and if you want more, if you've got any questions, you can email me, drop me a message, and we can schedule a call and talk about how this might work for you. So I think I've got time for some questions. So I'm just going to check the chat. Oh, that's okay, Victoria. If there's any questions, feel free to put them in the chat. And if anyone wants this recording, just send me a message and I'll send you the recording as well. Hi, Sarita. Oh, I already went, you joined a bit late, but what I'll do is I'll send you the recording in regards to that question. I covered that at the beginning. So I'll send you this. Maria's asking, have your patients reduced the size of fibroids or just stop the growth? Size reduction, Maria. And obviously stopping, yeah, the growth. That's okay, Sarita, no problem. Maria's asking if they reduced them, how long did it take? On average, to be honest with you, 3 months is quick, but I would say on average 6 months. If that, before the surgery, is it a requirement to have medication? Which medication, if that? You're welcome, Alero. Alero saying, thank you so much for this. Very certainly simplified. You're welcome. I'm glad you found it comprehensive. You're welcome, Maria. How long does the healing take after the myomectomy? I was told to wait 6 months before trying to conceive after my myomectomy, but that may vary. So always go with what your consultant advises you. But I think on average 6 months after a procedure. If that, like contraception as prep before surgery. I'm not too sure if I understand. So if you should take contraception as prep before surgery, I'm not too sure. Why would you take contraception as prep before the surgery though? Unless your consultant wants you to for a specific reason, but I'm not too sure. How to select a good surgeon? That's a good question. Definitely have at least 2 conversations, you know, and you know, speak to them about the materials they'll use, as in with the adhesion reduction, as I mentioned in the presentation. Speak to them about their techniques. So have at least 2 conversations, maybe do a private consultation and an NHS, or if you can do 2 within the NHS, at least 2 as a minimum. You're welcome, Jamie. I'm glad you got some helpful information. Yes, go ahead and speak.
Hi, Nina. Yeah, the question was regarding taking some sort of medication as a prep. I don't know if all surgeries require it or not, but I've been asked to take contraception, but I kind of took it and then I stopped. And I wanted to know if that was something that was required for all surgeries.
Okay. Well, I wasn't, that's a good question. I wasn't asked to for mine, but then mine was done quite a few years ago. A lot's changed, so I wouldn't be able to comment in all honesty because I wasn't asked to. And I've not heard of that actually. I know about the hormonal injections ahead of surgery, but not contraception. Do you know why you've been?
I think it was to prep and kind of make sure that there's no periods anymore. As far as I know, because I did ask her a few times, do I need to take this for the surgery? And she said, yeah, because if you don't do this, then it was something strange. She said, if you don't take the contraception, then it's like you haven't tried any other options, and then the surgeon might not let you do the surgery. And I was a bit confused.
Oh, I see. I get it. So it was exploring that route before actually you get into the surgery. So it was to see whether that the contraception would reduce the bleeding and manage the symptoms. And if it did, then you wouldn't need the surgery. That's
Yeah,
what I was given then.
yeah.
Yeah.
I don't
Okay.
know if I should have carried on with it or not, but I kind of stopped now. Now I'm working with you, so I don't really know what to do in that situation. So yeah,
Yeah.
I
Yeah.
haven't been
Yeah.
back to say anything to the doctor. I've just kind of left it, and just gonna see how it goes. With working with you, I'm sure it's gonna work brilliantly. So
Yeah. Well, Maria's saying she was asked to take contraception too, but it was more to stop them growing.
all right, yeah, okay, that makes a lot more sense actually. Thank
Yeah.
you. Okay, thank
You're
you.
welcome. Thanks for your question. Okay. Um, okay, so if that's it for questions, thanks for joining, ladies. Please don't be fearful. This is all about just having more information and just being more empowered in your decisions and obviously what you can do to put yourself in the best possible position, whichever route you decide to take. And that's what this is about. Obviously, if you know a woman that's struggling, please share this training with them. And I'll make sure you get the recording as well, because I didn't get, it was a lot different when I had my myomectomy, and I was told a lot of things would happen, but it didn't happen. So you've got full control and just keep believing in that. You're welcome, Ifat. Thank you for joining. Thanks, ladies, for coming. No, okay, question. Asante, Sana, Nina, a very thoughtful, provoking presentation. I'm glad you've got value, Asante. Thank you for joining. You're welcome, Mary. Mayal. I'm never sure whether to call you Mary or Mayal. You're welcome. Thanks for joining. Have
Hi,
a good evening.
hi, Nina.
All right. Hi, Victoria.
Hello. Sorry, one last question. I'm sorry I joined late. I just wanted to ask how many myomectomies you actually had. Because I remember when I met you, I think you had only had one at the time before you
Yeah,
had
it's
had.
always been that one. Never had any more. I vowed I
thank
wouldn't
God.
do it again. It was
Okay, thank God. Okay, I was
horrible.
wondering. That's okay.
Yeah, no worries. Okay. All right then. Take care. Have a good evening. Bye.
Thank you. Have a good evening as well. Bye.
You're welcome. Thank you. Bye.
Thank you, Nina.
Thanks.